Hello everyone, my name is Stacy Lavilla and I participate on the Action for Health Justice Communications Work Group. I am also the Communications Director at the Association of Asian Pacific Community Health Organizations, also known as APSHO. Before we get started, we would like to ask you to take a few seconds to respond to the poll on your screen so we can get a better understanding of who our audience is today. Okay, I think we can close the poll. And according to the results, over half of you already collect patient stories. About a third don't, but would like to, are interested in it, and I see 20% are not. Okay, and thank you all for responding, and we can go ahead and get started. I wanted to thank you for joining us for today's The Role of Storytelling Post-ACA Enrollment webinar. I am your facilitator for today, and I'm excited to be a part of this webinar about storytelling and the importance of collecting personal patient stories as we continue with ACA enrollment. Joining us as your presenters today are myself, Christine Harley, who is the Senior Policy Advisor at the White House Initiative on AAPIs, and Michael McKee, who is the Director of Health Services and Community Partnership at International Community Health Services in Seattle, Washington. Next slide, please. Now, before we start, I want to just go over a few housekeeping items and let you know how you all can participate in today's webinar. Here we are looking at an example of the GoToWebinar attendee interface, which is made up of two parts. There is the viewer window, which is shown here on the right side, but actually might be on the left on your screen depending on the browser you're using or operating system. And what this does is it allows you to see everything the presenter will share on their screen. The control panel, which is shown here on the left, but might be on the right on your screen, allows you to participate in the webinar. By clicking the orange arrow button, you can hide or show your control panel. You can also set the control panel to auto-hide or not to auto-hide by going to the View menu. Please note again that all attendees are in listen-only mode and will be muted during the presentation. After the presentation, we'll be holding a Q&A session. To participate, you can click the blue Raise Hand button on your control panel underneath the previously mentioned orange arrow button. Please note that the questions will be answered in the order they're received. Alternatively, you may also submit questions in writing during the presentation by typing them in the questions field. We will be reviewing them as they come in, and we'll address them during the Q&A session. Today's webinar is being recorded, and you will receive an email with a link to view a recording of today's presentation after the webinar. Next slide, please. Okay, and I should say that we scheduled the timing of this webinar to very purposely follow the March 31st enrollment deadline. And we did this not just because we thought it would be a little more convenient, but we did it because we felt that now is actually a good time to be thinking about what your organization is doing in the way of collecting personal stories, and to put something in place before the next enrollment period begins later this year. And so with that said, I will begin my presentation by giving an overview of storytelling, why we should collect personal stories, and the purpose they serve from the organizations that request them, and how they can also be used by your organization. So some of what I'm saying is going to be basic. You actually might all know this, but I think the points that I'm raising will help provide context and shape a framework for us to work within. So here at APSHO, in the communications department anyway, we receive requests for patient stories all the time. They are in high demand. And since the implementation and enrollment period began for ACA, we continue to receive a steady stream of requests. And there's a lot of interest out there in how many people are getting enrolled. But not only that, there's also high interest in who these people are. So on the right side of this graphic, and I apologize because that's a little bit faded out, I've listed the types of agencies that have been making requests for these types of stories. And they are media, lawmakers, federal agencies like OMH, and the White House. Next slide, please. So why are they interested? Well, there's a dual purpose here. Personal stories, first of all, help gauge the effectiveness of a strategy. That's one reason. The second is they serve as proof that the strategy is working. So if I put this all into the context of the Affordable Care Act, it looks something like this. On this first point, lawmakers, the media, federal government would like to get some sort of gauge on how the Affordable Care Act is working. So one of the ways they do this is by looking at the individuals that the ACA is targeting. And by looking at these personal stories, they're getting some idea of who is enrolling. They can determine if ACA enrollment strategies are working. They can see things like if more people are getting health insurance. They can see if a diverse population of individuals is getting enrolled. They can see who those people are. Are they young invincibles? Are they low income? Are they AAPIs? Are they Latino, etc.? So stories, for one, can help serve as an instrument that gauges pretty informally and definitely non-scientifically the effectiveness of the ACA. And on the second point I note here, those stories then become, as a consequence, a form of evidence or testament that our processes or strategies work. The personal stories, in effect, show that the ACA is needed. Next slide. So we've talked a little bit about how personal stories benefit other organizations. Now it's time to talk about how it benefits your organization and the individuals you're serving. So why do it? It takes more time. It requires more resources, both of which I'm sure few of you, if any, have in abundance. So why does this matter so much? It matters because there is indeed a payoff. And so I've listed some of them here. For one, personal stories raise awareness about an issue. And here it's the uninsured, the populations you serve, and the benefits of the ACA. Second thing it does is they shed light on the work you do and the important role you're playing in your communities, serving AAPIs and getting them enrolled. And my last point, they may encourage other individuals to enroll. Well, what we're talking about is when we're moving into the next phase of enrollment and future phases of enrollment and collecting stories and getting them out there, we're talking about using them to improve our enrollment efforts as we move forward. Next slide. Okay, so why stories then, and why not something else? And I'll start from the top and move clockwise. Quite simply, stories are one of the most powerful and effective tools we have to influence change. Stories can be motivating, they can be inspiring, they can challenge, they can help us understand. They really help create an image, a picture that can become imprinted in someone's mind. The next point is that they put a human face on an issue, which is tied to the point after that, where it helps individuals better understand complex issues. Stories can more easily show how a policy or program, or the ACA, affects me in the real world. The Affordable Care Act, as many of you know, is complex, so personal stories can help a reader understand it in more simpler terms. It can give readers more of a bottom line of what it means for everyday people. The next point is it stirs compassion. And what we're talking about here is that stories evoke emotion. And so humans don't really think about things that they don't care about. So if someone doesn't care about the Affordable Care Act, and they then see a personal story out there that talks about how John Kim has lung cancer and can't afford health care and therefore can't get treatment, if a person sees a story like that and then sees that now John Kim can get health insurance because of the ACA, that story will tend to tug more at a person's heartstrings, and it may cause them to care. And the last thing I want to say here is that when I say we're trying to evoke emotion, it's really not to be manipulative, but we're using stories as a way to make a meaningful or personal connection between a reader or an audience member and the issue we're talking about. And my last point here is that people simply remember stories above all else. Often stories make people feel something, and people tend not to forget that. And so why stories and not something else like a statistic or data? Because people remember stories, and they tend to remember those more than they will a statistic or data fact that you give them. Next slide. Okay, so following on my slide about why to collect stories is my slide that provides another answer to that question, and that is that when you collect stories, they actually become your stories, meaning they become a tool that you can use to your organization's benefit. And I've listed 3 ways that they do that here. The first is in the area of advocacy. They can be used in your efforts to educate policymakers of the work you're doing and the individuals who are benefiting from your enrollment efforts. It can shed light on the niche you're serving in your community. It can help you advocate for more funding or policy changes by showing how many people and who is affected by current rules and regulations. The second item is the media. Again, the media, if they're writing a story, they are almost always going to ask you for a personal story or someone they can talk to whom is affected by the issue that they're writing about. And it will really be to your benefit to have these stories ready and in your pocket. And when you do and you're able to give it to the media, it will bring life to that story and therefore bring life to the work you're doing. And the last point, which is fundraising, is one I think is sometimes overlooked, and that the personal stories really can become an important component in your fundraising collateral. And that they can be used in online campaigns, a brochure, a simple letter that goes out to funders. Again, these stories help draw a personal connection between the individual you're hoping to influence and your cause. These personal stories will allow donors to see where the money is going, who is benefiting from it, and in effect, the good they are doing by contributing to your organization or your cause. And I wanted to say again that it is important to keep collecting these stories if you're already doing it. And if you haven't, it would be a good time now to think about this, to devise a strategy or method in which to collect these stories before the next enrollment period begins. I also wanted to say that I do understand that there are very real reasons and very real barriers that keep organizations from collecting stories. And my hope is that in this webinar that we'll be able to address some of those barriers in the Q&A session. And this slide closes out my presentation, and I would like you all to take another poll before we move forward. Okay, I think we can close the poll out. Okay, and in this poll, it really is to address the issue of barriers. And looks kind of close, but at the top is 50% of you who would say you would collect stories if there were tools that were readily available that you could use. And then next up would be that another barrier is lack of resources, which is understandable. And the final one is org buy-in, which I also recognize as a barrier. Okay, thank you very much. I now want to introduce the next presenter, and that is Christine Harley from the White House Initiative on AAPIs, who will talk about why the collection of personal stories on outreach and enrollment continues to be important. She'll talk a little bit about the White House Initiative on AAPIs, and she'll talk about how her agency uses these stories and why they matter. So Chris, I'll let you take it away.
Thanks, Stacy. Okay, great. Now you should be seeing my slides. So first of all, I just want to actually say thank you all so much for all of your amazing efforts around the Affordable Care Act, and just congratulations on a job well done. We're still glowing from the fact that we have 7.1 million and counting individuals and households that were able to sign up for the Affordable Care Act through the federal exchanges, and it's really entirely due to your tremendous efforts to make that happen on the front line. So I just wanted to start off by saying thank you. So again, I'm Chris Harley. I'm with the White House Initiative on AAPIs. Next slide. And I was basically asked to come and talk about, what the importance of stories around the Affordable Care Act and beyond have for our efforts to support your work in the community. Next slide. So I just want to start off by saying that, we know that the reason that the Affordable Care Act was so important to the AAPI community is because so many of our communities have a disparity when it comes to health insurance coverage. And so, here's an infographic that the White House did, crunching the numbers around how many AAPIs would be impacted, but then also the disparities around in individual communities. Next slide. And we know that the lack of health insurance is a leading factor in regards to why there are disparities related to preventable and treatable diseases, or even, being able to go and visit a doctor. And so that is, that all of these things tie together. Next slide. And that language access contributes greatly to these disparities in being able to find a doctor or a health provider who can provide linguistically and culturally appropriate services. And I think that there are studies that show that language access is the #2 barrier for accessing health care and to visiting a doctor. So all of these things are contributing to the factors that impact health care for the AAPI community. Next slide. But I think that that is basically the point of the need for stories. So we have these statistics. We may or may not know about these statistics. And by me, I should be clear that I mean the folks in the government and in the legislature that are making decisions about, in Washington, D.C., about policies that are going to affect the priorities and funding decisions that impact how resources and policies are distributed around the country and get down to the folks on the ground. So, even in those decision makers, not everybody is aware of these statistics. And whether or not we are aware of the statistics, we don't necessarily understand what that experience is actually like to not be able to communicate to a health provider in the language that you speak, to not be able to go visit a doctor because you don't have health insurance, right? Like, those are not necessarily experiences that we have under our belt and understand to be able to incorporate that awareness and understanding in the decisions that are being made around policies or around funding priorities. Next slide. And so this is where, these stories come in to really shape the framing and to give these decision makers a handle on what then become the types of solutions and outcomes that need to be addressed in the decisions that they're making. So, one of the stories that we were able to get in the last few weeks of the open enrollment period came from actually an intern that has been helping us out for the past few months, and she was able to get her mother to tell her story about being uninsured for the past 8 years and raising children without health insurance, and then talking through the process that she went to find out how to enroll, to go through the enrollment, And then the immediate outcome was that she was able to get a needed surgery within a few months of signing up for health insurance. And so it was a really effective story. She was able to tell it in her native language of Hmong, and it humanized this whole experience of being uninsured, of being a mother who is uninsured, and then going through the process of getting insurance, and then the outcome that comes from now having health insurance, to being able to see a doctor, to being able to get the care that she needed. So I think that there are two ways that stories are used in DC. So one, like this slide is showing, is a way to connect to people, like through a social media campaign or through op-eds or through these blogs, to personalize the issue, to make it relevant in our efforts to make something that is as boring as health insurance sexy and cool, right? So we were, the White House and the initiative worked really hard to get, various spokespeople like Mindy Kaling and Phil Yu from Angry Asian Man to talk about their experiences. And Phil Yu of the Angry Asian Man's website talked about how he went on healthcare.gov and was able to sign up for health insurance. And so having those kinds of spokespeople, be able to tell a story, elevates it to a broader awareness. But then also having the patient stories is what makes it relatable to the folks on the ground. So that's one way in which I think stories are being used. Next slide. And as Stacy said, we know that there's going to be ongoing efforts. And so one of the strategies that the White House initiative is working towards in collaboration with other initiatives is around a project that we call Healthy Engaged Youth, or HAY. And so this is trying to engage young people in talking about these things. And we know that, for example, one of the special enrollment periods that will be coming up later this month and into the summer is around college graduation, as students leave their school health plans, that they will have a new opportunity to think about what the healthcare option makes the most sense for them. So having stories from young people talking about how important it was for them to go online and find out and see that it's easier, have that experience of making a choice about health coverage will be really important for us, not only for those individuals, but to keep sharing that story and to keep encouraging other young people to be involved. And I think that when we try to engage other advocates and other leaders in DC to talk about these things, they want to have these stories to be able to personalize their remarks or to make their own push and plug for the Affordable Care Act more relatable to their audience as well. So, we do also, share the stories with those spokespeople so that they have that flavor in their remarks. Next slide. But I think, for me, one of the most important reasons that stories are vital to the way in which we engage with decision makers in DC is around the policy decision-making that happens. So at the White House Initiative, through our engagement with communities around the country, we have 4 cross-cutting issue areas that we are now working with the interagency working group that has members from more than 20 different agencies addressing these policy issues. So data disaggregation, language access, capacity building, workforce diversity. And so as it relates to the Affordable Care Act, language access is going to be key. We heard over and over again that language access is a issue that the Asian American and Pacific Islander community really struggled with in terms of having materials that were in language that were translated properly, that the interpreters on the call centers, were accessible, that the website, didn't have easy to access links or materials that helped our communities understand what was going on. So for me, being able to take stories from your experiences of working with people who faced barriers in getting online because of their immigration status or because they couldn't understand the materials, those are the stories that I am going to have to take to inform the way that I speak to our agency partners as we think about what the next phases of implementation are going to look like. Because this is, from my perspective, between now and November 15th at the end of this year, this is the opportunity for us to really shape year 2 open enrollment and to look at all of the barriers or troubleshooting areas that people experience and try to figure out what are the solutions and strategies that we can take now to make year 2 open enrollment a smoother process for a broader scan of people. And if I don't have stories from the Asian American community talking about the specific needs of this population, it's going to be that much harder for me to help inform the discussions with these decision makers about what makes sense and how we need to address these barriers. And so that's where I think, stories like Miley's story help us think through, this is what went right, this is what went wrong, where we need to focus and where we need to move forward with tools that are working but maybe need to be freshened up a little bit for the AAPI community. Next slide. The initiative is also working with regional partners out in the states, because we realize that while it's important to have folks understanding the needs around the country in DC, it's also important for our regional partners to understand what's happening locally. And so what we'd really like to be able to do is connect all of you directly with the regional interagency working groups that exist around the country, and tell these stories also to them, so that as they're thinking about their next phases of strategies for year 2 and year 3 and beyond around open enrollment and healthcare access and the Affordable Care Act, that they're also understanding what's happening locally to be able to respond to specific needs for specific communities, right? That it may not make sense for folks in, I don't know, New Hampshire to be creating materials in Hmong, but we really want to make sure that, our partners in Region 5 that are overseeing the state of Minnesota are aware that there's a Hmong community that exists there, and so are tailoring their own outreach and engagement activities to that population. Next slide, please. And then finally, back in DC, we have been working with the agencies to develop plans around, specifically around Asian American and Pacific Islander engagement for their agency programs. And so, again, being able to help them understand where the policies that they are implementing make sense and address the needs, and where there are still gaps or where there is additional support necessary. These stories help give that depth to understanding the types of solutions and where those issues remain. So, for example, with HHS, I think that they have been a front runner in thinking through data disaggregation, and so we really applaud them for that effort. As it relates to language access, though, you know, it's great that we have the Spanish language website, but that's obviously not going to be that effective for engaging non-Spanish speakers, right? So this is where we can take these stories of how the API community tried to navigate through this website, where those problems exist, so that we can think about and work with HHS to think about what the next steps are. So I guess what I would say in conclusion is that the Asian American and Pacific Islander community, I think, is so unique in the diversity of the community and the needs that we have. And so the more stories we have about the experiences of, you know, LEP, limited English proficient individuals, the stories that we have around immigrants, the stories that we have around different ethnic groups who, you know, may have a higher need for specific types of outreach. Like I have heard that the Pacific Islander community may not benefit from having written materials, but may need other types of in-language support to understand the Affordable Care Act. Those kinds of stories are really important for us to hear and to be able to then funnel that information to these decision makers so that we have a better outcome that addresses the complete and holistic needs of the community. Next slide. So that's my presentation. I hope that it was helpful, and here's my contact information if you have any questions or would like to be engaged with us. I will also say that the initiative is actively engaging in collecting stories, and we're always open to hearing from the community, and so feel free to share anything with me, and I will also say, you know, for Stacy, that if Action for Health Justice is gathering stories and would like to share any of those with the initiative, we would be so happy and pleased to receive them and to help use them to help shape the way that we engage with our federal partners. Thanks so much.
We have one more poll for you all to take before we move forward. Okay, can we close the poll out, please? Okay, and so we see that actually almost half of this group has shared stories with other agencies. About 30% use those stories for your own benefit, and 24% have stories but aren't using them. Thank you for completing this poll. I appreciate it. Okay, our final presenter is Michael McKee from ICHS in Seattle, Washington. And he will be presenting on what his clinic has done in the area of personal stories by talking about its digital story project. So Michael, the floor is yours.
Great. Thank you, Stacy, and thank you, everyone, for coming today. I actually hope that there's some golden nugget of inspirational message that you'll be able to take home today and kind of use in your own personal work. I always feel a little bit humbled because I know that we all are in this business to make a difference, and we all do it in our own ways. And again, hopefully this is a little bit of an opportunity to get inspired and to kind of find something new in terms of an idea. But just to sort of kind of ground the work that we're talking about, the International Community Health Services is a federally qualified health center, and this we have two main sites and two satellite sites in the Puget Sound region of Washington in Seattle. And this is a picture of our clinic in the International District, and we have others. Next slide. just to sort of remind us all that the stories I'm telling are actually the stories of the folks who actually did the work. And these are two pictures of our in-person assisters who were at a enrollment event and who were available to answer questions, but also to actually enroll people. So you see that they're using tablets to actually do the work. So a little bit about our story. Next slide. So in our efforts to reach the communities who were in need of information regarding the Affordable Care Act, we were able to have one-on-one contacts with a little over 14,200 people. This does not include our social and media contact. We provided in-person assistance to 9,926 people, and we enrolled 5,904. And what's important to also know about Washington State is that we are a state-based exchange. So we had some of the similar challenges that the federal exchanges had, but we were up and running fairly soon after October 1st, so it wasn't as much of a delay in some of the other states that were federally run. And then unlike others in Washington State, ICHS had a significant percentage of patients who we helped enroll in qualified health plans. So folks who were 139% of the federal poverty level or higher, although we still had a majority of individuals and families who were eligible for Medicaid. And I should also note that Washington is a state that did expand Medicaid, so it was available to folks with 138% or below the federal poverty level income. I also just want to emphasize that we did not do this alone. ICHS has a long history of participating in collaborations with our local Asian and Pacific Islander serving organizations. So we were able to really leverage the resources that we had in sort of engaging with other community-based organizations like Asian Counseling Referral Service, Chinese Information Service Center, and really kind of make sure that we work together to engage the communities in a conversation about the Affordable Care Act. And then we also did a significant amount of ethnic media engagement where we have a number of local newspapers serving Chinese, Vietnamese, Korean, Filipino communities as an example, and really trying to get stories out to them, but also to actually pay for advertising. Next slide. So the first place where I actually thought about how do we collect stories, and what came to my mind first was that we really did this first by just listening to our staff, and we provided a space where we met regularly and weekly to stay aware of the issues that were being faced by our patients as they were trying to assist them in the enrollment process. And by listening to our staff and collecting those stories, I mean, I guess the theme you'll hear throughout all of our presentations today is that they were used to advocate for improvements, and we used them with elected officials. We used them with individuals who were leaders in other organizations to try to also speak on behalf of patients about some of the early concerns, which I think Chris Harley spoke to on some level in relation to the quality of translations, the quality of interpretations when it was over the phone call center support, obviously the website access, which was not available in Asian languages, and then for, I think, a significant number of us who served the refugee and immigrant communities, the problems with identity proofing that were unique to immigrants and refugees that really delayed the and prolonged the process by which it took to enroll them, so it took more resources. And so we used the stories we collected from staff to write letters and to attend public hearings and to meet with the Health Benefits Exchange staff and really kind of get members of our local Asian Pacific Islander Coalition motivated and charged up to kind of speak on behalf of the communities that we were trying to serve. So even sometimes when you don't, my main point with this slide is that even when you sometimes don't get a patient to tell their story, if we're able to listen to the staff tell the patient's story, that's often enough to get some of the advocacy going. Next slide. But from collecting stories from our patients, we really relied on our in-person assisters. And I will share that we had, ICHS trained 25 people to do in-person assistance, and only 3.5 of those were dedicated as full-time in-person assisters. Others took that duty on in the context of their other types of work that they provide at ICHS. And what was important for the in-person assister, and I think partly what Stacy has addressed, is that we really focused our time on helping patients enroll. And so the IPA identified a patient who was interested in telling their story, and they just collected contact information. So they, took the name and number and sort of the brief idea of like, this story is about patient language access, or this story is about newly covered, or this story is about, super happy about being able to see a doctor again for the first time in a long time. And then we passed those contact information on to our internal marketing and communication staff, who followed up with the leads and then conducted interviews and ensured that media release forms were signed and so forth. As a logistics issue, because language was often a barrier, we did have to use our in-person assisters to participate in some of those interviews, to provide language support and to really be the bridge between the enrollment process and then the media story collecting process. Next slide. And I guess I already shared that we realized the importance of collecting stories when we did focus the IPA time on actual enrollment. I would echo what Stacy shared earlier, is that the request for stories came often and came, sort of at times when you were not always able to meet the demand. So we do feel like now that the qualified health plan period for enrollment has ended, there's a little bit more of an opportunity for our staff to follow up on some of those story leads. And so we do have a plan to continue to collect stories so that we can be a little bit more prepared for this next round of enrollment. And also to realize that the story can also change a little bit because Medicaid enrollment does not end. So there's opportunities to get stories out there about, if you think you are eligible for Medicaid, you may still have an opportunity to enroll in the healthcare options available to you. And then, as Stacy also mentioned, we have a project here that we call Digital Stories, and so our plan is to create a few digital stories. So next slide. So just so we're clear what digital stories are, we create 2 to 3 mixed media videos which are used as an advocacy and empowerment tool. They are a personal story told in the first-person narrative. We initially used them to create awareness about healthy eating and active living, but we have expanded that to just, in general, like access to care, hepatitis B awareness, which is a disparity experienced by many of our communities, and now enrollment, and then by extension, exercising your new health insurance by participating in cancer screenings and so forth. But we have also used them with policymakers to advocate for healthy policy improvements. And we have found that the digital stories are useful in that regard because it can be somewhat intimidating and overwhelming if you're an immigrant who does not speak English well, to stand up in front of a large group, and by providing a 2 to 3 minute first-person narrative about why they think keeping the community center open for more hours is a way to collect that story and then share it publicly so that they don't necessarily have to speak on their own, they can do it through the digital story. And I think more than anything, what's been shared by the other two speakers is that these digital stories really do provide a context for the statistics, so that we can talk about how many people don't have access because of language, but if you hear somebody talking about that experience, it can often be more motivating for policymakers and also for media to print stories if they have sort of a human perspective. Next slide. So our first story that we plan to create next is to tell a patient perspective digital story, and this is a picture of this gentleman whose story will be told, and he's in his early 60s. In Washington State, we had a basic health plan which sunsetted on December 31st. So he and others who had basic health were required to find other types of insurance, and he was super excited and had really, from our staff's perspective, unbelievable gratitude for the assistance that he got to enroll in Medicaid, because he was eligible for the expanded Medicaid. And he's somebody who will be able to continue to access care and didn't have to experience any time period where he was not insured because his plan was ending. Next slide. And then the other story that we think we'll focus on next is also to tell a story from the staff perspective about what was their experience in regards to helping people enroll, and really sharing the fact that this was such a community effort driven by partnerships and by collaboration, but also like helping them feel like they were making a difference by meeting and fulfilling a need in the community, and feel like that will be really kind of helpful in motivating others to kind of keep the message alive about the Affordable Care Act. So we're not able to actually show you, next slide, we're not actually able to show you a digital story example today, but I did want you to have an opportunity to, at your own convenience, you can get copies of the slides. The website, mappingvoices.org, is a collection of stories from a number of agencies, not just International Community Health Services, that you will be able to find perhaps useful. And many of them are in Asian languages and or address issues around health literacy, access to screening, access to care, as well as healthy eating and active living. And then there's also a link to a specific story about ICHS addressing the importance of cancer screening and health literacy. So you can watch those or others on your own time, but really it will help solidify, I think, for you what the digital stories are and what they can be used for. And then I think through the Asian Action for Health Justice, once we have the digital stories created specific to outreach and enrollment, we can certainly make those available via a YouTube link and or the Mapping Voices link. Next slide. So Stacy asked me to talk about what lessons we learned, and I think that the first lesson is that I think we could always do better. Really feel like if the next time around we'll have a little bit more opportunity to be prepared for collecting stories throughout the enrollment process, and we won't be so overwhelmed with just the community demand for enrollment in general. And we do hope to integrate a story collection tool into the workflow. When I talked to some of our in-person assisters and to the lead, they really found it to be something that story collection was something that they needed to integrate into their interaction. So asking simple questions like, would you consider telling your friends and family about your experience? Or if they had noticed, as an example, that somebody had an extremely positive experience, then they would use transitions like, it seems like this process has been really helpful for you. Would you consider sharing your story so others can benefit? And I think that these are really practical ways in which the in-person assisters were able to make the transition from I'm going to help you enroll in healthcare, and now I'd like you to tell your story. And so they really kind of had to figure out ways, and this was some of the ways that they did that. Next slide. And then I think, as I've already mentioned, we really intend to collect stories at the beginning of enrollment, and so November, and not stop until the end. I think that telling the story of enrollment is so important, and like I said earlier, we really felt like the request for stories was never ending, and we always felt like we didn't have enough. And then other really simple but I hope meaningful, practical recommendations is that we wish we had taken photos at all of the events and not just select events. And we wished that we had been a little more proactive about ensuring media releases were signed, because we often find ourselves with really good photos that we can't use publicly. And so we were trying to do better next time around in implementing some of those procedures and so that we can. And then the other last-minute tidbit I got from our in-person assister lead was really to just remember to remind staff as to why these stories are important. I think sometimes it's really it's intuitive for executives and to directors and managers to understand why we actually ask to collect these stories, but we need to provide that context for our staff who are actually collecting it. Next slide. And so I really want to thank you for the time to share our experience. This is just a photo of 6 of our 25 individuals who were trained. So really on their behalf, I'm appreciative that I'm able to share some of this with you. And if you do have questions, feel free to follow up with me later. That's it. Thank you.
Thank you, Michael. We have a few minutes to begin the Q&A portion of our webinar. If you have any questions, please click the blue raise hand button as shown on your screen, and we will unmute you in the order received. Alternatively, you can submit questions by typing them into the questions field on your control panel. Okay, we have a question for Michael, and that is, what are some of the tangible ways that your digital stories work has paid off?
Sorry, I had to unmute. I mean, I think a really specific example, I alluded to it during my presentation. We had a very passionate digital story regarding an elderly woman who accessed all of the exercise and social events that are available to her at the community center across the street from our International District Clinic. And we worked with the group of elderly who access these services to create a digital story, and we shared it with members of the Seattle City Council as they were considering budget cuts for community centers across the city during 2009 and 10, when the economic downturn was hitting the city pretty hard. And we were able to retain 10 additional hours that they had planned to cut that we really feel was at least correlated with the fact that they had seen the story and heard firsthand from the users of the community center. And I don't think that the individuals who helped create the story, would have felt comfortable speaking in front of a city council meeting. But the fact that we were able to host an event and invite city council members and to share the digital story, I think really had an impact on that policy.
Okay, thank you, Michael. And Chris, we have a question for you, and that is, we have individuals who are nervous identifying themselves for the government or other authorities. Are there ways around protecting the identity of the individual who volunteers to tell his or her story?
Yeah, thanks, Stacy. I would say that while having a name is really helpful, really what we can use is a lot of the identifiers, right? The ethnic background, the gender, the age, and the particulars of the individual's medical history. We did receive during our week of action push, as we were one of the agencies, asking Action for Health Justice for stories about enrollment of the AAPI community, and we received a bunch back, and we didn't have names, and so we put some made up names for for those stories to then share them out with the media. But so I think we are happy to help protect the identities of the individuals who are sharing those stories. But again, I do think that where we can share the specifics of the situation makes it that much more helpful. I also just wanted to really emphasize what Michael was saying in terms of collecting stories from the staff experience. I think that has been tremendously important for us in talking through and understanding the enrollment experience, not just from the consumer perspective, but also from the agency perspective of time invested in needs and resource needs for organizations that are trying to do this work.
Okay, thank you, Chris. And this will conclude our webinar. I would like to thank Chris and Michael. I'd also like to thank the Health Forum for its support and helping to make this webinar possible. I'd also like to thank all of you for joining us for this training. Please keep a lookout for an email from Action for Health Justice, which will include a link to today's webinar and a link to a very short survey. Thank you all again, and hope you all have a great rest of the day.